media applications, but I have LinkedIn, which is a professional application. And there was one guy talking about why genius guys always wear the same clothes. And I said, what? And it was like this. I saw this guy, you know him, always wearing the same pants and the same t-shirt since 1998 till 2010. And why Steve Jobs, one of the richest guys on earth, is always wearing the same clothes? Should be a reason, right? I'm not there. Okay. And the reason is that, and it's this guy, the guy who wrote this is a musician, but he's also a neuroscientist, saying that people, you can do like, say in Spain that only women can do more than one thing at the same time. Men are only able to do one thing at the same time, right? But from the neuroscience, we know that we are able to manage like 3 tasks at the same time, no more, okay? So then we need to focus on what is important. So we need to put our focus on things that will make a difference, and this is important. And what is happening with these decisions? We need to take so many decisions for a single procedure that sometimes we get lost. So we need to really focus on what it is really important, or what it makes a difference. And I will explain a little bit further what I mean, okay? So when we're talking about the static areas, we can ask ourselves if the tooth needs to be extracted, and when is the best moment to place the implant? Can we place implants in extraction sockets? Is the plate important? The presence of the absence of the plate is important. Should we need to graft the gap between the implant and the bone risk associated with this procedure? And all these questions I will try to answer in a this is coming from an article wrote by a Spanish doctor, Gustavo Avila and Pablo Galindo. And Pablo Galindo did this decision when we're for it. I mean, we just anesthetize and do the extraction, and nobody's questioning if, oh, can I save this? Can I make a socket shield? Can I make a submerged extrusion? Or no, they just do the extraction, place an implant, make some money out of it. And it's not like that. We ask ourselves all these questions, and if we finally get some reds, we go for the extraction. And as my friend Giulio Rasperini says, we can still do a lot of things. If you extract it, okay, so you better keep it if you can. Talking about the timing, probably a lot of speakers will talk about people do delayed implants. From the Straumann company, because the Swiss guys, they believe that immediate implants are not very accurate, and they prefer to do it in a delayed mode, waiting for these 4 months. And of course, we can place immediate post-extraction implants. So if we ask ourselves, should implants be placed in extraction sockets? I would say yes, yes. As far as we can get a nice primary stability, no infection, and some other things we will say in the presentation. The position will be the best one. We will reduce the time, we will reduce the amount of procedures, we will not need to do any further graft or soft tissue graft or hard tissue graft. So we are saving time and money, and we are able to provide the best aesthetic result. This is important, the integrity of the facial bone. It's very important because the first thing we need to do when we want to do something is to have a kind of classification. And there are a lot of classifications in the literature, but the one I accept in implant dentistry. And if you see type 1 is the one we want for every patient, we have good bone and we have good type means that we have good soft tissue, but we have